for your foam rolling, three basic areas that we're going to focus on are, well, I guess there should be four then. The quads, the glutes, the butt, the hamstrings on the back of the leg, and the calves, okay? Now the idea when you're foam rolling is to put extra time and extra attention and really be intentional with your breathing on areas that are painful. You may have to reduce pressure a little bit. You may not be able to put your full weight into there. You may have to use legs, arms, what have you, to lift slightly off the roller. But you should be able to, through intentional breathing and being mindful about what you're doing and kind of reconnecting to those areas using the foam roller, be able to add pressure over time, to increase that pressure as time goes on. And that's going to help the nervous system down-regulate, calm down, and things are going to be into a position where we can do a little bit of stretching and kind of relax everything and get it set up for the week to come. Okay, so we're going to start with the quads. I like to start up at the hip and work down to the knees, but if you want to work on the other end and work from the knees up, that is perfectly fine. Big no-no. Do not roll into the knee joint itself. Stay just above that knee joint. We do not want to roll over joints. That is not comfortable. It is not safe. We do not need or want to do that, okay? So what we're going to do is we're going to start just rolling up and down, and we're going to typically roll about 3 to 4 inches at a time, kind of pulsating back and forth in that little 3 to 4 inch span for 30 to 40 seconds. So your whole leg, the front of it, should take about 2 minutes. And if you find any pain points, any pinches, any ouch, damn that hurts, that's where I want you to hang out, and I want you to focus on your breathing until the pain and the discomfort subsides slightly. Okay? So we're gonna get on top of the roller, like so. Like I said, I get it up toward my hips, but not actually in my hips. And then all I'm gonna do is slowly roll back and forth using my arms and my toes as pivot points, anchor points to kind of push off of. Okay, moving down the body, you can roll yourself up it or the roller down you, either way. Boom, keep going, keep going. And if you want to add a little bit of movement, especially, so I found a nice little pain point here. Focus on my breathing. Still allowing my belly to expand. Chest expand next. Full exhale. Once you get to a point where that's comfortable, you can actually go through some movement in those pain points, and that's going to be a huge, huge benefit as well. Okay, so working up and down the leg, 2 minutes minimum there, focusing on those pain points. Then the hamstrings are typically another area that people are going to have some issues with. I like to start down toward the knee and then work my way up here. It's just a little bit easier. And all I'm going to do is work up and down. Once again, finding pain points. When you find those pain points, hang out there like so. Focus on your breathing. Allow it to subside a little, and then you can go into a little bit of rotation, getting the inner and outer hamstrings. Okay, you can rotate in and out, same direction. Whatever feels good, whatever works for you. The biggest thing is to just work the entire hamstring belly itself and really give attention to those points that are nice and sore. And then for the glutes, we're actually going to kind of turn sideways here. You can either do it with a straight leg or you can get a bent leg. And we don't want to really roll over that bony protrusion on the side of the hip. You may get to it a little bit, but typically up above and around that hip area is where you really want to focus. So we're going to get in there, just kind of grind through that tissue a little bit. Focus on that breathing. Breathing is key. And then you can even do a little bit of flexion and extension of the leg, the hip, as you find those pinch points. Even a little bit of rotation may even help there, okay? So that's position number 3. Again, these should be at least 2 minutes on each muscle, really focusing on those pain points and really giving good intention to your breathing during the hold and focus on those pain points. And then the calves, it's the same as the hamstrings. So we're going to lift off the ground just slightly, like so, rolling up and down the calves, working down toward the Achilles, Okay, we don't want to roll onto the heel, but we can get pretty far down there. Right above the ankle is typically where I stop. And with this one, you can find those pinch points, do a little bit of ankle movements, circles, gas pedals, what have you. You can rotate the legs in and out. You have a lot of freedom because the calves are a little easier to move around and mobilize. And again, 2 minutes, find some spots that feel kind of sticky, that don't feel quite so great. Spend extra time there, focus on your breathing there, and then go into the mobility exercises that I will be sending